Thank you for staying with us. Now, we were just about, Dr. Akingbanye was just about to respond to an email from Emmanuel, who sent in his comment from Luxembourg that he didn't feel the effect of health officers the last time he came to Lagos.
I don't know. I want to, with regards to the author of the question, I don't know what time last he was in Lagos, but the time, whichever way we look at it, environmental officers in the service of the state are working, going around households with a view to detecting nuisances and evolving ways around to abate such nuisances.
I'm sure you operate in specific areas.
No, we operate in all the areas. The only thing that we can take note of is the fact that in the service of the state, which we can also say in the local government, how many of these officers do we have there? The problem is actually the fact that every year, the number of officers in the state, they get depleted. And you look at it, in each local government, no local government in the state right now can boast of 10 environmental officers. And you have to juxtapose that with the population of that community, of that local government. Yes. What WHO says is that one environmental officer should take care of 8,000 of the population. I am supposed to oversee the environment, well-being, and whatever of 8,000 people. But right now in the state of about over 22 million people, what we have is one health officer to about 35,000 people. And the implication is such that when you see one environmental officer in your street today, before you can see him come around, it will be a very long time. And nuisance is something that comes up every time, every minute. Lagos State absorbs people, attracts people from all walks of life every day. And so we have environmental officers that have been trained, qualified and certified, they're even registered and licensed in roaming the streets in Lagos State without being employed. This is what explains the reason why you will say, okay, you don't see Wole Wole. Wole Wole are there in existence, but this is how we are handicapped. Okay. We are constrained by the number of people that carry them. Not only in Lagos State, the government of the day generally seem to lose sight of from the point of prevention. Okay.
You are an environmental officer.
Yes.
About 2 weeks ago, we heard that there were cases of Lassa fever in Lagos again. What is the situation now?
Well, I can say categorically that the situation in Lagos State is calm and we don't have any issue right now. That which we heard about two weeks ago within the community of Lut, and that is taken care of. Only one was outside Lut, and that one went outside Lagos State. A lady from Lagos Mainland, I think, went outside, took ill, and instead of her to wait within the health system in Lagos, went to go and visit the husband in Ogun State, and that was detected. And immediately, the environmental officers in the local government, with the aid of the Yaba local LCDA, already swung into action, went to the place, disinfect the whole neighborhood, deratize the whole place to make sure that if peradventure we have the vector of Lassa fever, which is the Mastomys natalensis, the species of rat that transmit this disease, is taken care of. And also some of the households were given infrared thermometer to measure, to monitor the body temperature of the inhabitants in that area for early detection.
In the case of an emergency where you're alerted that there's a breakout here or something's happening in terms of like a disease outbreak, what's your response time? How quickly do you get there?
It's immediately spontaneous. We respond immediately, yes.
And when you arrive, what are the basic things? I know that you have the uniform, so for ease of identification, but what are the equipment that environmental officers come to any location with at every point in time?
If there is a reported outbreak, what the immediate thing we want to do, let's take Lassa, for instance, if there is anything like that, we go with a thermometer to make sure that people are identified, are taken. All suspected people are evacuated, moved to the health facility with the help of the DSNO officers who immediately also contact the DSNO at the state level to make sure that necessary actions are taken. Then environmental officers go ahead to make sure that the environment is sustained, is made clean, is disinfected. And
do they come with those equipment to disinfect the environment?
Yes, that's what I said. The only case we have around, which is Yaba, is not even there. What they do immediately, I don't have the clips here, I would have shown you. What they did immediately, they went ahead and started disinfection.
Okay.
And disinfestation.
In one sentence, can you tell us what we should do so that we remain healthy? We don't have any public health issues. In one sentence.
Well, prevention is better than cure. And I want everybody to take responsibility for their health, in the sense that you make sure your personal hygiene is of a high standard. Your environment is made very clean. Rat runs are not allowed. Your food are covered. You don't leave leftover on your table. You don't allow rodents to have access to your thing. Then keep your environment clean. Sanitary waste receptacle. Make sure your sanitary dustbin is cleaned, is covered, and is high.
Dr. Samuel Akingbe, President, Environmental Health Officers Association of Nigeria, Lagos. We also had the Kogi State Commissioner for Health, Dr. Saka Audu, who joined us from Lokoja via Skype. Sunrise will return with another interesting conversation in just a moment.